Okay. Feel like I'm a little short. Okay. Mr. Nis, can you hear everything? Are you good? Okay. So let me start by welcoming everyone that came out tonight. And I want to start by saying this is not a regular board meeting. This is a community forum. So there's no voting, no action, nothing's going to be taken tonight. Okay. This is just to talk. Okay. So my name is Melinda Williams, and I am the newly elected president for the Van Buren School Board. And I wanted just to maybe talk about two things that have come up since we announced that we were going to do this. So the first thing is the question, why? Why are we doing this now versus why didn't we do this in August? And the reason for that is because of the new variant that is much more contagious, maybe not quite as severe, but much more contagious. And our health department and our hospital system has asked us to maybe have some conversations on things that we can do to help reduce the community spread of COVID. So that's the why that we're doing it now. And we just want to have a conversation. We want to have a dialogue. And I was telling Mr. Bloom that I'm really proud of our district, that we can do this as a community, that we can maybe come together and talk about some things so that maybe we can, just help our community a little bit more. So I am very, very proud that everyone's come and that we're going to have a very open, polite, respectful conversation. So I just want to thank you for that. We do have a program, so if you didn't get a program, it's right outside the door, and you might want to get one just so that you know what the speakers, the order is going to be. Kim Thomas is going to be our Master of Ceremony, so she's over there. Yeah. And she's going to be introducing speakers so that it flows a little bit. Welcome, come on in. And then Andy Fisher, right here. Yay. Andy is our mobile moderator, so he's going to be walking around with the mic. After we have the speakers talk, there's going to be question and answers sessions, periods, and Andy will walk around. So if you have questions, he promises he might run, so be careful, but he's going to run to you, walk to you if you have a question, and people up here can answer them, probably the medical people, but also the administrators as well. I just want to read real quick guiding principles that we kind of thought were important to talk about before we start the forum. So the first is we believe that in-person learning is the best avenue for educating students. We believe that parents and students are partners in education and open communication is paramount. We believe in providing a safe learning environment for students and staff. Believe that being respectful requires all of us to show kindness, empathy, and compassion. And finally, we believe that being resilient requires us to adapt to changes and engage in healthy practices to promote overall physical and mental well-being. And these guiding principles come from the quest and the plan on the page that hopefully you guys are all familiar with by now. So to start, on the right side of the program is an order of speakers. And our first speaker is going to be Kim because she's going to be the Master of Ceremony. So I'm going to sit back down. Thank you again.
All right, I'm going to introduce Mr. Kareem Barati. He is our health commissioner for Hancock County. He also has been providing data for most of us for the last almost 3 years now. So until now, I don't think anybody really understood the role of public health in our community, but as you can see, it has now taken a spotlight for most of us. So Kareem.
Well, good evening. Thank you, Kim, and thank you, Melinda. Thank you, Brian, for the invite. I think this is a great idea to bring the community together so we can listen to each other, so we can ask each other questions. Instead of talking at each other, we need to talk to each other so we can get through this pandemic. We're approaching, finishing a second year in this, and we're getting into the third. Things are not looking good because of the Omicron virus variant right now. Just over the long weekend, I should say, we added close to 1,000 cases of the Omicron. This is way too high. This is the highest we've ever, had in Hancock County. Before I start giving you like a quick situation update on what's going on right now, again, I want to thank the administration and I want to thank the board for giving the opportunity for that dialogue to happen. I want this to continue. I heard from a lot of you, the first year of the pandemic, on one end or another end of the spectrum here of masking and online schooling and all the stuff that was going on back in 2020. And I really appreciated the people who reached out and talked to me about it or wrote me emails about it. This all means a lot to me as a public servant to listen to you, as well as you guys listen to what we have to say and what the scientists are saying. I want to applaud all the efforts that's been done here at the board level, at the school level, at the parents level, at the community level, to bring the kids back in-person learning last year, and the year before, late in 2020. As we were learning more about the virus, we learned how to adapt to it and how to kind of protect ourselves. We have meetings every week with the supers, and Brian is always the first to sign in on that meeting. He's very engaged, and I want to tell you, if he didn't tell you yet, that a lot of the other districts in Hancock County look up at what you guys do and take note. He brought a lot to those conversations, and I want to thank him again. And I want to thank him for keeping the schools safe. And I tell all the supers every Wednesday morning, you guys done a marvelous job in keeping our kids safe in the classroom. Is what happened before and after that you guys don't have control over. That's probably contributing to that spread of the virus. Nonetheless, we're counting on your help as parents, as community leaders, for your engagement. Just coming in here, means a lot to your students, to your kids who are in the school system, means a lot to the community of Van Buren as well. I have some good news for all of you. Probably you know that by now. Van Buren community is one of the highest vaccinated community in our county as well. So congratulations and thank you for that as well. So active cases, we're up to about a little over 1,500 active cases as of now. That means one in 50 individuals in Hancock County probably has the virus and they are an active infection. Those numbers are really, really low. Probably the real numbers are a lot higher because of the antigen tests were available a couple of weeks ago, right before Christmas, and a lot of those tests are not being reported. Moving forward, this pandemic is going to end at one point, and I hope that what we're hearing that with the Omicron is that's how the virus is going to become endemic and just like the flu or anything else. And that's why I want to kind of urge all of you to support some measures here until we get through those couple weeks safely. I do ask every week the supers to go back to their boards and ask their boards to renew the conversation about mask policy. If not a policy per se, how about we urge our parents and our students to wear masks, our staff. That's the only way we can keep them in class. I think we learned that by now. Our hospitalization is up. We recorded 9 deaths the last 7 days. So suffering is still occurring, although you guys heard a lot about Omicron being mild and just like, a mild cold. It's a lot more. It's affecting our community still. Our average cases per day is a little over 221. And our cases per 100,000 shot up 100% since last week. So we doubled. And that was to be expected with that Omicron spreading so fast. But we need to slow it down a little bit so we can preserve our hospital resources, so we can preserve the community resources, and that we can keep our kids in school. So the bottom line, we're still surging. The expectation is probably we'll still surge another week or so. Then it's going to peak at some point, and the hope is for our numbers to go down as fast as they started going up. I want to talk a little bit about masks and the effectiveness of masks. And I brought with me a lot of studies showing that masks are effective. I'm willing to share those with you. And as you have questions, we'll share some of that studies as well. But one that's close to us and close to you guys, the Wood County schools. Back in the fall of 2021, they did a little study, that's close enough here for us, on their masking in schools. And they found out that for elementary age students, unmasked and or unvaccinated close contacts were 2 times more likely to become a case compared to masked and vaccinated close contact. For students older than 12 years old, unmasked or unvaccinated close contacts were 3.3 times as likely to become a case compared to masked and or vaccinated close contacts. Bottom line, 3 years into this, or 2 years and going into the third here, hopefully we won't finish the third and with this, masks do work. I mean, that's the bottom line. I have study after study that's scientific, that's been peer reviewed, showing that masks do work. They don't work 100% alone, of course not. We've always talked about layering, masking, distancing, cleaning, hand washing. All the other stuff will work together. But immediately, vaccines do work too, and boosters do work. But immediately, and I think until you can make a choice for yourself and for your children, I think masking will help immediately kind of limit that spread. That's my introduction here, and I'll be here for questions. I'll be here to start the dialogue. That's what I'm hoping for, and I hope I can change some minds today. Thank you.
All right. Thank you, Kareem. We really appreciate you coming out tonight and providing that information to us as a community. Next is Dr. Coase. Dr. Coase has been around our community for decades and decades and decades. And so those of you who have not had the opportunity to meet Dr. Coase, he is probably one of the more well-respected physicians in our community. He has spent his life taking care of our community and likely has taken care of you, your family, or friends. So with no further ado, Dr. Coase is part of the Blanchard Valley Health System's COVID task force.
Thank you. Thanks, Kim. Thanks for everyone being here. So I'll make some comments. I've got 2 objectives that I'd like to talk to you about. One is, what is the hospital situation? What's the healthcare situation? What is going on? And I think what we see in our community is the same thing that's going on across the United States. And the other thing is to just talk about mitigation strategies. I'm not going to repeat what Kareem said. I completely agree with him. But at a high level, it's not, if you take anything away, you've heard people say that when they talk, what do I want you to hear? There is no magic bullet about this. There isn't one thing that's going to take care of all of our COVID problems. But if you add all of those together, they all seem to help. I think where we are, and this is my maxim, when we first started with COVID, if you can go back and remember what was being said at a federal level, President Trump, administration, CDC, and everyone, we wanted to flatten the curve until we could get to a vaccine. That was the idea. Flattening the curve meant it didn't, and nobody ever said we're going to prevent people from getting it. We needed to put it off as long as we could because we didn't have several things to be able to take care of people. If you remember when we started, the problem was protective devices. We didn't have masks. A lot of you in the community made masks and brought them to the hospital because we didn't have those. We hadn't planned for a pandemic, an epidemic, that we would have those kind of supplies. We got into problems with other supplies, even things like just being able, Mike sitting here from our pharmacy, to just get IV tubings and to get normal saline and to get all kinds of things. That supply chain became a problem. And then we had difficulties with ventilators. When we first sat down, we started talking about this. It's hard to believe it's been 2 years ago. We thought that there might be 300 to 500 people at a time that we'd have to be taken care of in a hospital with a capacity of 150. So we tried to make arrangements with hotels, with the university. Where are we going to put all these people? Because we didn't know what was going to happen. We didn't have any treatment. We were trying to figure out a new virus that no one had ever seen as to what did we need to do. And as time went on, we got better. When I say got better, trying to figure out what to do, there were some treatments that were developed, and we made progress. And as you know, without going through a lot of history, we've had 3 waves, and we're in one now. And another thing that I think is important to understand, we all talk about the COVID or COVID. There's different kinds of COVID. What we're dealing with now is a different disease than what we talked about when we started with what most people call the alpha COVID, the original COVID. Viruses mutate. That's going to happen. This is not the last mutation we're going to see. That doesn't necessarily mean we're going to have another wave. Depends on how we try to do things as a community, as a nation, of what we can do in a global economy with global people about what is going to happen with the next thing that changes. But Omicron is different because it's a bigger genetic variant, and so our treatments don't work as well. And we don't have the things that we had before, and that's the reason it's more contagious. And I'll talk a little bit about vaccines in a minute. But I think it's important to understand that, the science of what is going on. And I know it's confusing to everyone because things do change, but they change because the virus has changed. We've learned more. We have data like Kareem talked about masks. We have about certain kinds of medications and things like that. So where are we with the hospital? We're full. This morning, I think we had about 20 people in the emergency room waiting to get a bed. Most of them got admitted fairly expeditiously after we had discharges. Not all of them were COVID. We have 40-some people in the hospital now that do have COVID. Those COVID patients are generally younger, unvaccinated, not as many on respirators as what they were because they're younger, but we continue to see a lot of COVID patients. The other thing, though, that we see as far as patients are a couple things. We are starting to see people come into the hospital. We had somebody come in the other day that needed, let's say, to have an abdominal surgery. They didn't appear to have COVID, but they were COVID positive, which increases the probability of having a problem during surgery. Anyone that gets admitted, we check for COVID because there's some ramifications to our staff, to anesthesiology. But in addition to that, to the patient, that it's not good to have an infection when you're going to be going to surgery. So that's one of the things we're seeing. And in addition to that, the third thing is we're seeing a lot of people being readmitted that have chronic diseases that were made worse by having COVID. So if I had heart failure, people put off coming to the hospital for lots of reasons. They were concerned. They didn't want to get COVID. They were afraid of what might happen if they got admitted, that they would catch something or whatever. So people put things off, and they didn't seek the normal kind of care they would, which has made the comorbidities and those kind of things even worse. So that's what we're seeing at the hospital from a patient standpoint. Now, what's happened with our supplies? Really, we're in fairly good shape. Masks are not a problem now. We have ventilators. One of the things that you may have read about was in the newspaper this week that we were talking about not only our supplies, but our medications. This Omicron virus has changed the monoclonal antibodies that everyone talked about. There's been different strategies across the country of how different, let's say, communities and states approached it. And basically what this is a very specific something that would be formed by your body that's been manufactured as an antibody that fights the antigen, which is the virus, and it goes in and it does something with it. Originally, the monoclonal antibodies we had were 90% effective, something like that. With Omicron, because it's changed, it's down now much lower than that. It's still effective. But the biggest problem we have, it's not available. There just isn't very much of it. The old Regeneron, the other kinds of drugs that we had aren't effective. And so we just changed our policy, which meant we needed to go back. It's not available to everyone. We're following CDC guidelines, so someone over 65. But the group, in addition to that, that's really concerning is anyone that's immunosuppressed, which are many more people than what you would think. That's someone that's on certain drugs, or they have certain diseases like lupus or rheumatoid arthritis, and they are on medications that take care of their immune system not as effectively. One of the things that you will hear, and even I say, and I think maybe we said tonight, when we talk about the Omicron virus, it is milder, but that's on an average. And I don't know what mild means. When there's 1.5 million people in the hospital, I don't know whether that means mild. It does seem to be upper respiratory. People don't get as sick, but that's again on an average. There's a lot of people that are obviously in our hospital. Our data would say across the country, and what we think we're seeing too, about 95% of the cases we see are Omicron. So that's what we're dealing with. So if we've got 50 people in the hospital, it means, somewhere around 47 or 48 of them have Omicron. So it's not mild to them because some of them are on respirators. We have deaths every week of people that are dying. And again, it's a younger age group. It's in general, 75% unvaccinated about what we're seeing. So from our clientele or our patients or our customers or what at the hospital level, especially, but even in healthcare. I was talking to one of our family physicians tonight, trying to get a time to get down and talk to him. And he said, we just don't have any time. We're working through lunch hour, trying to figure out what to do with COVID. So that's from the patient standpoint. The other thing, I think, just talking about healthcare and probably is concerning to me, and again, you've probably read about this, is the morale of the healthcare staff. It's been really tough. I mean, we have lots of nurses that are mothers trying to go home. They don't want to take something home. They're working 60 or 70 hours because we don't have enough people to work. And there's a lot of reasons for that too. A lot of people took early retirement, especially in healthcare. They didn't want to be exposed to this. It's been very difficult to recruit. There aren't that many coming out. And so we've had problems and things have changed. And I think you would understand that. We all started out in the COVID fight together. It's become, let's say, we're just not all in this together. It was talked about earlier. And so the feedback that a lot of our frontline staff get, especially in the emergency room and on the floors, are how people interact with them and what they say. We've changed our visitor policy. That's become contentious. We require people to wear masks. Sometimes that becomes contentious. So from a standpoint of healthcare, that's kind of where we are, and we're no different in every place that you go around here. There is nothing different. And I can talk about a lot of things. Blood is short. We don't have enough blood. People are not giving, concerned about COVID for whatever reason. But in general, I think from the standpoint of we feel with our healthcare system, we're really getting along pretty well, especially compared to everyone else. So that's healthcare. Don't mean to have a negative. We're doing the best we can. And like I said, I think we're accomplishing what our mission and vision is to take care of the community's health. Now, the second point is, what are the mitigation strategies? I'm not going to go over what Kareem said, because he's right. Masking, social distancing, washing your hands, really eliminating being in big groups, trying to be in rooms like this when you're going to be in a room with good ventilation so that the virus can't be there. It comes down, it's pretty simple. If there's enough viral antigen, enough viruses in the air, you're going to get it through the air and you're going to become exposed, and a lot of people are going to get COVID. I want to mention something about vaccines, and I know that is a controversial subject across our country. And I'd like to think, it's not just with education, because a lot of people read different things, understand all of that, but to just maybe talk to everybody about what vaccines are. The one thing we can say about the COVID, and I'm generalizing now when I say COVID, the vaccines that we have, the 3, and there's more than that out in the country, it is unbelievably safe and it is unbelievably effective when it started compared to other vaccines. The idea behind a vaccine is to give your body some kind of a external focus to make your own antibodies. Vaccines have been around for a long time. We eradicated in the world smallpox because of vaccines. Polio is not any longer a disease we worry about. I grew up, we had to quarantine at school because polio would be around. We don't have to deal with that. And we have, I think as everyone knows, we have vaccines to mumps, measles, rubella, all of the kinds of things that used to be big problems that we had to deal with. And I'm going to come back to that in a minute. So this vaccine works with mRNA, and I'm sure you've heard a lot about that. There's concerns. I think it's rightfully so to be concerned. That is not an issue. I don't know that I'd want, if I'm thinking about this, okay, do I want my kids to have it? Do I want in my case, do I want my grandkids to have a vaccine? We don't know that much about it. That is true from a standpoint of, we haven't been there. I'm not clairvoyant. I don't know what's going to happen in 10 years. What I can say is, if you look at the vaccine that's been given, we are not seeing significant side effects. We haven't had any anaphylactoid reactions, which means somebody had a really bad reaction and died. We have not seen long-term effects. I talked to the coroner today. I don't know how many 100 people have died in Hancock County since COVID started with COVID, but we haven't had any related to getting the vaccine. But to say, do I know what's going to happen? No, but I can say theoretically, mRNA has nothing to do with the genetics of someone. It's not DNA. I can say that if you look at DNA and what viruses do to DNA, the virus themselves, there's all kinds of problems. I think you've all heard of Zika. We've got diseases that have occurred. Rubella babies were a terrible problem when I was in medical school, that have been eliminated because of vaccines. And realizing again, this is a different vaccine, but it did go through all of the trials, because that's another thing that I hear about is, well, they cut corners. President Trump did not let them cut corners. They went through all of the trials. What he did do was expedite the process. So the FDA cleared it and looked at it and said, this is okay to move on. Now, again, some of that's subjective. People had to make a decision, the people that were looking at the studies and that sort of thing, but there weren't any corners that were cut. So I will just say testimonially, from a standpoint of the vaccine, my youngest son's wife got pregnant. 2 months into the pregnancy, the vaccine was available, and John asked me, what would I do? And I said I would get the vaccine. And so Sarah did get the vaccine. Now, anecdotal, one case doesn't mean anything. I understand that. But there is plenty of data out there that pregnant women that have gotten this have not had malformed babies, have not had problems, and are better off having been vaccinated than they were not vaccinated by what is being seen, by any study that has come out from the College of Obstetrics or whatever. And likewise, as I said, the data related to, one thing being a doctor, your kids all think they've got easy access. Maybe they do, I don't know. But I got a call, okay, what should I do for my two granddaughters in Tennessee, 14 and 16? Would you give them the vaccine? Yeah, for sure. And they both got it. But that's personal and what? And I could go on and on talking about vaccines. So I think the thing that I do want to say about vaccines, and then I will stop, is so why should somebody get vaccinated? And there's several, you've heard some of it, what's in it for you from a standpoint. It's good to put off as long as we can getting the infection. We may get oral agents that we're going to be able to have better treatments and what we can do. I think one of the, I would say, misconceptions of the vaccine is, well, people have gotten a vaccine, but they still got sick. We don't know how long it's going to last. If I had to be, and someone may ask me, prediction of how long is it going to be? It looks like maybe 6 months. I think we're going to need boosters. Maybe it'll be for a year. We'll have to see. It depends on what people get. But I think one of the reasons, the other is the big reason too, is that from a standpoint of society, wearing a mask really is to protect you more so than it is for me, that I'm going to get something. But if I'm infected, even asymptomatic, don't have any symptoms, I'm not putting this virus out. And the other, and maybe the last statement, is the concern about the vaccine. Again, I've said, I don't know what's going to happen in 10 years, but I am worried about people that have COVID, how they're going to be in 10 years. This long COVID is no joke. 10 to 30% of people that get COVID have long-term effects, being defined as after a month. And we've got several people that it's been months that are still in rehab, still having problems. Loss of sense of taste and smell may not sound too bad, but if you think about it, that means the virus attacked a nerve and it did some kind of damage to it. There's data that's going to make dementia worse, reported cases of diabetes. Now, maybe they're coincidental, but those sort of things. So I'm concerned about that too. With that, I think I'll stop. I think we're going to have some questions. And Kim, I turn it back over to you.
All right. Well, thank you, Dr. Kos and Kareem, for coming tonight and having the conversation with our district. And now we are going to open it up for questions. So anybody who has questions, Andy's up on his feet. Boom. And he's going to find you. If you have questions for either Dr. Kos or Kareem as we continue our conversation around the mitigation strategies for Van Buren. All right. Our first brave person. Thank you for volunteering.
All right, I guess mine isn't really a question, more of a statement. I didn't know we were going to be bringing up vaccines at all tonight, so I'm kind of disappointed that we did, because it is a personal issue, but everybody wants to say there's no adverse effects. Has anybody looked up the VAERS website, which is actually the CDC and the FDA actually verify these cases? And there's been over 1 million adverse effects, like debilitating problems from the vaccine. And last I knew, there was 18,000 deaths from that. So I just don't like when people get up there and pretend that that there isn't effects, but that's not the point why we're here, because I don't think anybody's asking our kids to be vaccinated. And the mask thing, do they work? You say, yes, they do. It's proven, but it depends on where you read it, because it's also been disproven. The microns apparently of COVID is much smaller than the holes of a mask. And I don't think all of our children have the proper N95 masks that would actually stop that. And kids constantly fidget with their masks. which is just getting the bacteria into the masks, and they're stuck breathing that all day. I don't think that that's the answer either. And I don't think that they are safe for everybody. Some people can wear them no problem, and that's great, but that's their decision, as other people have the decision to not wear them. I understand we do need to do something to try to stop this, but I know as of today, this school has 15 active cases. I don't know how many students we have here. I guesstimated 1,200-ish. And I don't think that it's out of control here, that we must be doing something right to keep these numbers down like this. And there was one more thing I wanted to say, but I forget. And I really don't need a response to that because obviously we're going to disagree, and I'm not a doctor, but I have read a lot. Oh, I was going to point on the mask subject that I did do a little bit of research on the 1918 Spanish flu thing, because a lot of people like to compare this stuff. And what I have found, if you don't use Google, because for whatever reason, Google doesn't tell you all the truths, but I did read that more deaths from that were actually due to masks because they were getting a secondary bacterial pneumonia from the masks. And whether it's true or not, but I did read it in multiple places. So I'm just asking and hoping that we can continue to be mask free, or it's your choice at our school. And that's important to my kids. My kids have both had effects from wearing it. My daughter, it affected her psychologically. She said, "Mom, I don't ever want to stop wearing these masks because I don't want people to see me anymore." Like, she got so used to hiding behind her mask that was her normal. And I think that's really sad. And then my son had a physical problem with it because he would come home every day from school with headaches and take naps. And that's super abnormal for that kid to do that. And he's never done it since. So it really affects people. I think you should be able to wear it if you want to, and not if you don't. And as far as helping anything else, I think cleaning the desks a little bit more. I know our high school is only cleaning the desks once a day, but yet kids are coming in every period, sitting in the seat somebody was just in. I think wiping them down would probably be helpful. And I know the kids don't have a lot of time to get from class to class in a day. They're not going to go to the bathroom and wash their hands. Maybe we should take a little bit of time out of certain periods of the day where half the class goes and washes their hands at a time, just so they are getting actual good old-fashioned hand scrubbing in. I know with the sanitizer and stuff, but sometimes just washing your hands is best also. I think that's it. Thank you.
Good.
Thank you. We appreciate you.
Yes.
Yeah. Thank you for your comments. Anyone else? Oh, sorry.
You're fine. I have a bit of a statement myself. So,
Can we have comments like at the end of the forum? Can you stay to make comments?
well, I would really like to speak what I have to speak, if that would be okay. Thank you. First off, thank you for allowing us to come to this forum, kind of speak our minds and, communicate. I think collaboration is a big thing. I know, working for the hospital, communicating with one another, understanding each other's grievances and how we make next steps forward is, a good idea. But I'd like to start standing up here and advocating for a parent's right to choose. There is no statewide or federal mask mandates anymore, of which the CDC has come out and revised their own stance on masks. Mandates in general are starting to be deemed unconstitutional per the Supreme Court, and lawsuits are being made and won all over, even in our state. Masks are also considered a medical device per the FDA, and the school cannot practice medicine without a license to do so. Due to this, a school cannot enforce wearing a mask, period. Please see the Ohio Revised Code 4731.41. The CDC guidelines now state that the only true effectiveness are N95s and KN95s. Cloth masks are not working to prevent the spread of viruses, and surgical masks are better than no masks if they are used properly and consistently. So right now, if you are going to follow the science, this is what is stated. Anytime a mask is touched, contaminated, not over the nose, with a proper metal piece, gaps at the side, gets wet or put down, it leaves the mask ineffective. Unless you are wearing a pneumatically sealed mask, airflow dynamics deem that the weakest point of airflow will get through. These expectations are unrealistic and in no way enforceable, as we have seen per the Van Buren School Facebook page when they were mandated in 2021. We see pictures of kids even now having masks in school that are not worn properly, visibly soiled, or sitting on desks. The CDC states these masks do not protect if not worn properly. It is in fact that children and even adults are more likely to touch their face if something is on it. This actually increases the transfer of saliva to doors, desks, people, and so on and so forth, facilitating the transfer of more germs onto surfaces, once again leaving the masks ineffective. Cloth masks are no longer good enough for hospitals either, so why put them on children if hospitals and CDC say they do not work? I can attest to my own child coming home from school with a wet mask on her face. This is more dangerous not having one at all. My wife actually took the liberty of taking a sample from a mask, from my child's mask, and a toilet seat at the local college, and putting it under a petri dish. The mask had more bacteria and growth than a toilet seat. At this point, knowing everything we know about masks with the new CDC regulations and hospital guidelines, I would greatly urge not to overstep parental rights of their children. As Board of Education, you should all be aware that the rights of parents are protected under the Ohio Constitution, Article 1, Section 1, 2, and 7. And dropping off my children to school every day and being at various sporting events and such, I can tell you the amount of children, staff are choosing not to mask them or mask their kids. Masks should always be a choice left for children, especially when only real way they work if worn correctly, which we all know is an unrealistic expectation. Also, if the concern about having enough teachers and staff is a concern, Patrick Henry schools and their health department had decided to stop contact tracing. Maybe this is due because the Omicron has mild cold-like symptoms or flu-like symptoms. COVID-19 is here to stay. Viruses will mutate because that is what they do. And more on and so forth. Lethal variations don't last long. That's virology 101. Acknowledging the data is skewed, sometimes overcounted, and even misrepresented in the mix of things. COVID-19 spread has never been documented completely accurately. And we see now that with all the backtracking by the CDC and others, even the flu vaccine misses its mark occasionally because it mutates from time to time. And taking the normalcy away from our kids and realizing the mutations, and we're going to acknowledge this and stop taking normalcy away from our kids and realizing it's hurting more than it's helping. I would urge our school to talk with the health department to stop this contact tracing. If the symptoms are no different than flu, why are we not treating it as such? I'm sure you are aware there are lawsuits being filed through Warner Mendenhall against school districts, school boards, and superintendents in Perrysburg, Springfield, Avon Lake, and for these very reasons, enforcing unlawful quarantine and segregating students in addition is unlawful masking. The Mendenhall law firm has already won such cases in Cincinnati, Ohio, University, and other lawsuits across the state are suing health departments themselves. By enforcing mask mandate, if that is what is decided, you're opening yourselves up for a potentially bad legal situation which would plague our school. I would just not assume parents in this district will sit back and let parental rights be stripped away from them. Also, in following the numbers out of Van Buren, I would like to state, as this young lady has said over here, we've only have 15 positive children at this time. I do appreciate the fact that the board and what they are trying to do to prevent the spread of this more contagious but less severe variant of COVID. I also realize it has put you between a rock and a hard place, so to speak. But this variant is so much less serious that the CDC has compared it to flu-like symptoms and have lessened quarantine time to 5 days if symptoms are improving. We never masked our kids during flu season. The most that has ever happened was schools closed for a day for deep cleaning. And they were all right. And they were all right back. No matter if you were vaccinated or not vaccinated, masked or not masked, we can still contract and spread the COVID the same way. Despite all the different views out there, one thing is fact. We're all trying our best to keep our children safe. And my hope is, in a world where everything is so uncertain, we can all respect each other's views and continue to leave the choice up to the parents. Thank you for your time.
Thank you for your comments. Really appreciate it. Thank you. Anyone else? Oh, right here. One right here. Here you go, sir.
I'd just like to say, yeah, I think it should be a choice. You know, if you want to wear a mask, great. If you don't, you know, it's a democracy, you know, like I think it should be a choice. And then I don't know if we're kind of the exception, but we haven't worn a mask probably since the middle of 2020 or had vaccines, and knock on wood, we never had it unless it was us didn't have symptoms or something. But so yeah, that's my opinion. All right, thanks.
Thank you for your comment as well. Anyone else? Oh, sorry. Here you go.
I don't like to talk in front of people, so I'll make this quick. I have a friend who is in the Bowling Green schools, and they were informed that the new Omicron variant was very similar to flu-like, and a lot of the kids they were seeing were having 24 to 48-hour short-term symptoms that were similar to flu and maybe just a low-grade fever. And that they were encouraging kids to stay home for about 3 days and then return to school. So I thought that was interesting that they actually had a set protocol for what their expectations were. And I think that would be good. No, Isaiah, you cannot talk on the. I did have a couple questions. I didn't come with anything prepared, but these were just a couple of questions that I had from what was said. And I know some of this was already touched on. I know the vaccines. I've known people personally who have been affected negatively by the vaccines, have had heart conditions. And so I just wondered how much that had been looked at by you personally. And then also the healthcare situation. I just wonder how much of that is the employment issues that we're seeing across all industries, like how much of the employment issues are influencing the healthcare system as well as you said people have put off coming to the hospital. How much of that has also impacted the overall numbers within the hospital versus like the actual COVID only coming to the hospital because I have COVID and I have no other issues that is causing me to go to the hospital. So I guess those are my questions.
Yeah, those are good questions. And I don't know if we have exact. I think your question about the first, if I want to make sure I heard you right, was about just the unemployment or the employment situation across the country. There's no question that is true. Specifically in healthcare, nursing is the biggest one, where a nurse can go to some other sector of the economy. The data would say it's been more retirements or getting out of inpatient kind of care and going to doing something else and that's pretty much what we've seen. Now, across the board, though, the whole frontline issue of individuals that are working in restaurants, that would be working in nursing homes, that would be working, let's say, entry-level positions, businesses, we're all seeing the same thing, and we're all competing for the same people. So you are correct about that. It's difficult to say about the COVID. I think your question, it's difficult to say about the people that are being readmitted because we don't usually see them having COVID, but their overall condition is deteriorated since they had COVID. So they're more susceptible to getting something else or their problem. But I don't know that we've really been able to quantitate that completely. And then the other thing is that people that have been admitted to the hospital, had a heart attack or had a stroke, are not going to do as well afterwards. They've already got a morbidity that they may be more likely to get something else or to be admitted. So I think your points are well taken. It's not all just related to COVID, although we are seeing, certainly are seeing a lot more. And one of the concerns when you get into statistics is the number of children that are being admitted now. There's 4 times as many children in the hospital with Omicron as what there had been before. That is attacking a younger group. And those are just statistics about what's occurred. I think somebody made a point. I know, Kareem, if you want to add anything. Oh, sorry. Then I didn't make that clear before. So we have about 140 people in the hospital. That's not, 150 is our max. That would include in obstetrics. In addition, we could have some neonatal, and we also have a psychiatric unit. So when we say the people that could get admitted, it's around 140. I think we had 46 today that are pure COVID, that came in with COVID. So if they didn't have COVID, we would subtract that from 140 and we'd have 94 people in the hospital. And what I was talking about, some of those other people that are in may not have had and may not, there's two parts to those. One had COVID, let's say 6 months ago, and just haven't done well and have been readmitted because of their heart failure. That's one category. Then there's the other category of someone that came in, I think I used the surgical analogy, that they were going to go to surgery and we did a test and they have COVID. They are asymptomatic from that, but a concern after surgery that it's going to flare up. That's, Kim, I don't know if that completely answered. That's what yeah, if you look at it, we're running in general a third. We got down in the summer, we were down to 10 or 11 after being in the 50s and 60s during late winter last year. Fell down. I think everybody thought that that we were past this, and then it came back.
All right, I want to kind of try to address some of the comments here, and I appreciate it. I always appreciated an informed citizen, both the gentleman and the gentlewoman here that spoke very intelligently about the issues. It's of masks, and the studies, and that's why I'm here. That's why I would love for you guys to reach out so I can show you the studies I'm looking at, as you shared the studies you guys are looking at as well. We always go by preponderance of evidence. If I have 300 doctors, 300 medical organizations saying masks do work with the studies that have been peer-reviewed, globally, I would tend to kind of believe or go with what, the preponderance of experts are saying. You did cite a couple studies. I've looked at those studies. Those were not peer-reviewed. And those were not examined by other doctors either. So there's a lot of information on the net, a lot of well, I shouldn't say information, a lot of misinformation. And I urge all of you to read all sides. I mean, it's very good to kind of read what people who are for masking are saying as well. As far as the effectiveness of the vaccine, I can tell you from just tonight's numbers here, we reported 6 deaths here in Hancock County the last 7 days. The first one is 65-year-old female vaccinated with 1 dose of Moderna. The second one was 86 male, not vaccinated, 62-year-old male, not vaccinated, 59-year-old female, not vaccinated, 79-year-old female, not vaccinated, and a 76-year-old male who's vaccinated. So here, right here in Hancock County, in our backyard, those are the numbers. Do I believe him or I believe something on Facebook that somebody said? Is 59 years old? Is that old? And I'm not, again, I don't like to discuss. I'm giving you the facts. I don't know. And like Dr. Coase said, you know what? COVID might not be the direct, COVID is aggravating what we all have. Per our last health assessments, 40% of Hancock County residents have diabetes. 40%. Sure.
Undergrad and graduate studies, I know not medical field, but what I've noticed and what every statistic professor that I've ever had, for lack of a better word, statistics are junk. They can point you in the right direction, but 99.9% of the time, they are not right. And with statistics, you're essentially taking a small sample out of a group of individuals and applying it as a generalized study to a larger mass. It's not necessarily correct. It's not necessarily wrong. But when you bring a study forward, you have to bring both sides. Here's what doctors are saying, or doctors saying about good thing about masks. Here's what they're saying not so good about masks. Here's our evidence to both sides. You make a decision. In all American history, even history in general, forcing something on somebody has never ended well for that other side. Never. And I will stand till the day I die and use scientific analytics to prove that, whether it be before or after. I'm willing to listen to both sides. But when you're bringing something, you need to bring evidence to both sides and let people make a choice for themselves.
Thank you. That's exactly what I'm saying. You're absolutely right. Yeah. And that's what I'm asking, everybody here to look at all the studies, not just the couple that will fit the narrative here. It's very important. And the gentleman brought up a lot of legal issues. I'm not going to go into those. I'm not a lawyer. I don't even play one on TV. I'm going to stick to what I know. And those needs to be sorted out with, with the legal community as well. Again, I have those studies I'm willing to share, and then you guys will make your own decisions. I hope we will never get to forcing anybody. It's not about forcing. It's about talking to each other and say, okay, you know what? If we have 99% of the people at the hospital and 99% of the people who are dying are not vaccinated, are not boosted, and you know what? I heard a lot that there's a lot of, this virus evolved for 2 years. Science changed. At first, we were kind of really stressing the need for cleaning the desks and everything. We found out it's mostly in the air. It's not. It is a little bit on surfaces and stuff, but that should not be our first one mitigation. Our number one mitigation should be to stop that virus that's in our airways to get into the room, to get into a closed room, to protect each other. If I'm asking, and you know what, on meetings with the supers, all we're asking is not for a change in policy that's going to be infinite. It's just put a time on it, put a metric on it. If we go above 20% of the cases, we'll go into this mode. If not, we'll drop automatically. Make some of it as choice. It's between you and the boards to discuss that. All I'm saying here, we're providing the evidence that masks do work, vaccine do work. And again, this is a good discussion because we want to hear everybody. I'm going to give you my card and my phone number and my email as well. Please reach out to me. I will have a discussion. I will show you what I see, what I'm reading. You guys all have full-time jobs. You have families you're busy with. That's my full-time job. I do look at the data, and that's how we make decisions. And that's how I want all of you to make decisions for your family, and I want all the boards to make decisions for their schools as well. Look at the data; it's very important.
All right, this gentleman right here has a.
All right. Okay. So you said look at the data. All right. Look at the data in Uttar Pradesh. If you want to talk about vaccines, look and see how many people have survived in Uttar Pradesh with COVID and how their COVID rates have dropped compared to, let's say, Israel, who's been pushing their fourth booster right now. I'm kind of going off the cuff here. I didn't write nothing down. So when it comes to masks, with what this lady over here said about the Petri dish, basically, and Ryan back here about the Petri dish on your face. The point is that with children, like she said earlier, with on the desk and all over the place, and we're not a doctor by any means, but where bacteria seems to grow is in warm, moist environments, and that's exactly what's underneath that mask. So I think we have a pretty good idea that we're not for it whatsoever. But I guess I kind of wonder, because I didn't realize we're going to be getting into vaccines and all that conversation today. I thought it was just going to be about our children and masks. But when it comes to the vaccines, like I said earlier with the Uttar Pradesh, I just don't see what's at stake if you write a prescription for ivermectin, which is, I guess, big, forbidden, and shunned. What is there to lose? If you have people dying left and right from COVID, supposedly, what's there to lose if you just give it a shot? It starts with you guys. You're the doctors. Why can't we just try it, see what happens?
Well, I guess that's a fair question. There is, and I'm sure, as Kareem said, you have, or some of you have data. There's been trials done. It is not shown that it's been effective. It has significant side effects in some people. So it is a risk benefit. We don't carry it on the formulary at the hospital because it's prescribed for what it's used. Isn't something that we've seen any cases of. But I do understand what your question would be. And there's a lot of those different kinds of things that people ask about. And we'd like to think, as Kareem said, that, and we are not always able to do that, to have looked at a trial that has shown that it's effective. I can talk to you offline if you want to talk about ivermectin, because we've had our doctors look at that and we've gone through. But that's specific on one. We can talk about hydrochloroquine. You can talk about probably any medication you want to pick out a vitamin. There's been lots of studies being done, looked about what to use. I mean, I think from a medical profession, if we thought it would work, we would use it. We're not opposed to using anything if it would be helpful. So that would be the standard answer. The question was about natural immunity. Well, I think natural immunity is fine. If someone has had this, that they're going to have some natural immunity. There's a couple things I'd say about natural immunity. One, it's probably going to last for 6 months also. So unless you're planning on getting it again, the problem not about natural immunity is if you're comparing it to the vaccine, you know how much antigen you're getting. Not everybody that gets natural immunity gets the same antibody response, because not everyone had as much infection. So it's, let's just say, a little more inconsistent. But I do think natural immunity is good for people. The problem is that some of the people that get natural immunity from getting COVID get long COVID. They have problems. It's a misconception in my mind to say, well, this is just a cold or an influenza. It's mild. Not everybody gets over it. It's just kind of accepted. I'm going to get over this. If I don't get real sick, I'm going to be fine in 7 days. That is not true. They're in the hospital. Kids are down in children's. Those are the things that happen. It's not that common, but it does happen. That's not what we've seen, like I said, with vaccines. We haven't admitted people that have had vaccines.
Yeah, I mean, I'm sorry. The last 7 days, yeah, one died. The last 7 days that is vaccinated. One out of the 6. Yep.
To kind of add to that, though,
sorry.
is my wife's friend's wife is a travel nurse, and she actually got the Johnson & Johnson within probably a good half an hour. She went into severe respiratory distress and had to be, within probably 24 hours, had to be taken to the ED twice. Not ours, but someone else's. Now, granted, that's probably a low percentage, but it's still a risk.
Sure. And
I'd agreed with you. I mean, that's why we watch people. So I do not, but if you look at statistics of the number of people, and it would be, I am not aware of anyone that's had long-term side effects, even when they've had anaphylaxis. There's been a few cases in Northwest Ohio. That's why we watch people of what's happened. There's nothing that's a free lunch. Anything that, taking one aspirin a day has significant side effects for the few people that get admitted with bleeding. So yeah, those things. But your point, again, your point's well taken. Don't disagree.
I just got a quick one real quick.
Thank you. So about why vaccinations are being discussed is because this is to talk about community mitigation efforts. And so vaccines are part of the mitigating effort. So that's why they're being discussed.
All right, so I just have a quick question. This is for the superintendent and the board members. First, I'll say I'm completely opposed for our kids wearing masks. I don't think there's been any actual evidence that these cloth masks work. Maybe the N95 masks work a little bit better. They probably do. What other solutions are we looking at as a district besides just slapping face diapers back on our kids?
All right, so we're here to discuss the mitigation techniques that we can use. I appreciate the face diapers as a cute analogy to wearing a protective device. It's definitely one of my favorites. Thank you. But that being said, you know, here at the hospital, and I work at the hospital, so I can tell you it's been a long season of life. And I guess part of my role is I get to help counsel people who have to make the last decision. And so it's personal to me, and I can tell you the amount of people that we have walked to the end has not been pleasant. That being said, I've worn my mask and I've stayed protected, and I have not gotten COVID. I've cared for patients that have COVID. That they do work. And yes, to your point, we started off with cloth masks because we were desperate. There was no ability to have enough masks for everyone. We've now moved to a state where we can get procedure masks, those face masks that protect people, and they have shown to have a great impact on the reduce of spread. Is that the right answer? I have no idea. That's why we wanted to talk to people, to hear where everyone is. It is really important that as a district we have these conversations, because the board is 5 people and we all are all over the place on what to do too. We're still in a pandemic.
Well, that's
We're
where I was
trying to
asking,
keep
what
the
are
school
some other
open.
ideas besides
Well,
just going back?
Yeah. and
Brian,
so-
Brian is going
Brian's
to speak
gonna talk
next, so he
next.
can probably address some of your
Because
questions.
the other real concern is, like Dr. Coast and Kareem have talked about, this is having an impact on health care. And so people are going to the hospital and they're incurring great expense. And so it does have a big impact. And health insurance is going to be the next big surprise for everyone if those premiums go up. So that to me is another thing we as a district need to pay attention to, is as people get sick, those premiums are gonna go up. And so we have to be paying attention to all the impacts of this wonderful virus that nobody has any control over. So I appreciate the frustration. I appreciate not wanting to have your kids in masks. I also appreciate not wanting to have sick workforce and kids that get sick, because it's a lot. So with that being said, I'm gonna let Brian jump in because we're doing.
Wait, can I say something real quick? First of all, I want to commend you guys, especially everybody on the board, from when this started, because you have left this decision in the parents' hands. So the parents that wanted their children to wear a mask, that was their decision, and the ones that have chosen not to put a mask on their child, that was a very, very wise decision. And I commend you for that, to continue that, because of exactly the legal implications over here brought out by this gentleman as well. Because we want our kids to have a safe environment, but also an environment that includes the values of their homes and their parents and the community, and the respect for the teachers, as well as them, whether they want to wear a mask or not. That should be their personal choice. And I mean, you can see in the audience here, you guys are here to represent us. And I've been very, very pleased with the decision that you've made to allow the parents to make those important decisions for their children and their families. So that's what I really wanted to put into play here. I love that you brought people to come in to discuss alternative views. It's important that the whole community hear this, but at the end, it is still very, very important, from what I'm picking up in this group right here, that the parents maintain the decision-making when it comes to vaccines, injections in their child's bodies, or whatever it is that the child is putting over their face that could be considered a medical device. So thank you guys very much for that.
Thank you for your comments. Thank you. One more.
I just want to thank the board for continuing to reach out to Blanchard Valley and to bring Dr. Coase and his colleague in. I think it's great that we're hearing from medical professionals and not just listening to misinformation that is shared. And I would also invite everybody to here to bring this passion when we, need to pass the next levy. This is the kind of conversations that we need and the kind of passion that the school district is depending on. So great job.
Okay.
right, that is the perfect
Thank you.
comment to end Q&A on. Because I think that is true right there. We are here because it is our district. We do want to have a great district. So with that being said, I am going to ask Dr. Coase or Kareem, do you have any other comments? And then if not, I'm going to let Brian talk, and you're welcome to stay, or you can leave for the evening. All right, everybody, Brian Bloom, no introduction needed, right?
Okay.
Is that John?
All right. Well, welcome everybody. Thank you for coming tonight. What I'm going to be doing tonight is just kind of updating like I have been doing for the past, I think, 3 weeks now, just kind of where we're at with numbers, how we're doing, staffing. You're also going to hear from our union after me and also some of our strategies we're doing to try to keep school open. Mr. Kelly is here, who's Director of Operations, who's going to kind of just highlight some of the strategies that we're using to try to keep school open. And before I get into our numbers, I do want to thank Dr. Coase for coming. And this is when I took the job or accepted the job, was offered the job, and I started in July 2020. In the midst of all of this, I can promise you, I did not think I would have on speed dial the health commissioner of Hancock County, Kareem. So I have met with Kareem more than I've met with probably anyone else in the district outside the board. Every Wednesday, I see your smiling face at 8 a.m. And I greatly appreciate that whenever we've had an issue, a question, he responds 8 o'clock at night, 7 o'clock in the morning. So Kareem is someone who cares about the community, and he does. He helps us keep school open. So thank you, Kareem, for always being there to answer my questions, especially when I first started out and I really didn't even know what COVID was. So thank you very much.
Thank you, Brian. I told you before, no need to thank me. Again, I said it before. I'm just a public servant doing my job, and I don't need thanks. That's my job, and I'm proud of my job, and I'm proud of comments like this. Thank you.
And then another weird one before I get into the numbers here. Dr. Coase and I graduated from the same high school. Now you're looking, thinking, huh? Well, not the same year, but we did go to the same high school. He is a proud Tiger from Pickerington High School, as I am, but different years. But anyway. Right. Is it not on? I don't think so.
His was much louder than.
See.
Now it is.
How about that? Oh, wow. That's really, really loud. And I do want to single out this wonderful person in the audience, and she's going to be very upset with me because I'm looking right at her. But Nurse Judy Prater, who has worked tirelessly to make sure that people are informed. She's waving right there. She has been working so hard to make sure the kids stay safe and communicate with the parents. So thank you, Nurse Judy. You've done an amazing job, and I greatly appreciate that. I'm just going to go over some numbers since our last board meeting, which was a week ago today. So on Friday, the 14th, I'll just give percentages and I can go into more depth if you have questions. So our elementary was a 13% absence rate. Our middle school was a 4% absence rate, and our high school was a 5% absence rate. Monday, the 18th, we did not have any, according to what I was handed, we did not have any staff absences among the teaching and aid world on Monday. Our elementary absence was at 12%, our middle school was at 13%, and our high school was at 9%. On the 19th, our elementary was 13%, our middle school was 9%, and our high school was 8% absences. Today, our elementary was, well, I'm sorry, it was 11%. I couldn't read my own writing. It said 118. I'm like, that can't be right. It's 11%. It was a percent sign. Mr. Bunn, you might have to help me with math symbols here after that. So Our middle school was at 10% and our high school was at 8%. Our staff has done an amazing job. We've been able to, since we've come back from the Christmas break, we've been able to cover classes. Our teachers have been doing exceptional jobs of filling in for each other. The parents, you have been phenomenal. I appreciate the communication that you've had with me. We really do appreciate if your child wakes up sick that you're not sending them to school. It helps us keep the doors open. It makes life a lot easier. So thank all of you. And am I supposed to say, do they have questions now or are we going to wait? Mr. Kelly, you get to come on up. John Kelly is the next one up, and he is our Director of Operations.
Okay, I'm here to talk to you a little bit about what we're doing as a district to keep the school clean, safe, and healthy. Those of you that have been here a while, I've been here 13 years, and about 10 years ago, 9 or 10 years ago, we started off installing hand sanitizers throughout the district. You may have seen them. We started at the entrances to the buildings with a little sign that says Help Van Buren, you know, keep the place safe and healthy. And then over the years, we just kept adding them. They're on the walls up and down the hallways. They're across from all the bathrooms. There's a lot of them in classrooms now, especially in the elementary. So hand sanitizers have been added. We've been doing it for a long, long time. We got more aggressive during COVID, obviously, but it's something that we have been implementing forever. When COVID started running rampant, the first thing we did, we met as a staff, we met at board meetings and so forth, and decided how we're going to do it. The one thing we did right out of the gate was added additional staffing. We knew that we would have to get more aggressive into cleaning, more aggressive into sanitizing, and that included in the school buses. So we added additional staffing, we added additional drivers. We went on a mad hunt to try to get substitutes in case we ran into a problem with that. So the cleaning has become more aggressive. We sanitize every desk every day, all the touch surfaces, the handrails. We have changed our cleaning products probably 3 times to something that we think is doing a better job. Some of these products can get sticky, so we've changed those things. But the custodial staff has been phenomenal. I mean, they have really gone above and beyond. And I have to tell you that the teachers, the students, everybody inside the building is taking part in helping this place to get cleaner and healthier all the time. I see teachers spraying desks. I see students spraying them. I see people wiping things down all the time. So it really has been a group effort, and I think it has shown. All the rooms are supplied with hand sanitizer. We have additional soap dispensers everywhere. We've put them in classrooms. Just about every place there's a sink, there's now soap and paper towels. The buses are getting sprayed down every day. We sanitize them every day. During the alternative learning days, we deep clean the buses so that we don't have an issue there. That's where I think we have the most amount of students in the smallest space. We're doing the same thing in the kitchen. I added food service to my plate here. Well, that's kind of funny. I added food service a couple years ago to my additional responsibilities, and they're doing the same thing there. It's just something that's always on our mind. It's always what we're looking at. It's what we talk about every day. And I think that from a cleaning and a sanitizing standpoint, I think we're doing about the best job that we can do. Any questions? Oh, that's at the end? Okay, don't ask any questions.
Thank you, Mr.
Email me, I guess. I don't know.
Don't leave yet. They might have questions later. Okay. Oh, I can do that.
Mic over to you.
Mr. Beining, you are up. Mr. Beining is the Van Buren Education Association president for our teachers union.
All right, a lot of the stuff I was going to talk about was already been covered, so I'm not going to waste everybody's time to repeat myself. Basically, we sent a survey out to all of the teachers asking their opinion on masks. The results I got back, I sent you guys an email with that information, but 20% of the staff said yes, mandate masks. 80% said no, leave it as an option. Something I wanted to add too is when you're walking around the buildings and looking at the kids and the staff, just rough guesstimate in the last week information I've just counted as I walked around. I would say about 20% of our students wear a mask. Not always right, but they have a mask on. And then about 15% of our staff wear a mask. Just rough for your information, what I've seen. The other thing I put in the survey was, where's it at? Thoughts on how we're handling COVID as a district. 50% of the staff said fantastic, could not be handled any better, which that's what I would be in. I think we're doing a lot of things correctly. 43% said we're doing an average job, and only 7% said we're doing a poor job. That was out of the 55 union members that were polled. I think that's it. Any questions? Okay.
Thank you, sir. Yeah, I think this one keeps the battery keeps dying. So another additional responsibility. A representative from our Van Buren local 783 couldn't be here. They did pass along a letter, so I was going to read it for them. So it says, "Good evening to all. We have all been dealing with the additional stresses the COVID pandemic has brought into our lives now for some time. These complications affect our lives and families in individual ways that we never anticipated. We each deal with the difficulties in different ways and have personalized ideas of what is needed to lessen the impact of these issues. The people represented within our bargaining unit are no different than any others in this matter. All of us make the best choices we can to maintain as normal a lifestyle as possible. Therefore, we as Local 783 will not endorse any mandate to perform an action or not to perform an action. We do endorse in this matter the rights and responsibility of all Van Buren staff and parents to make the decisions that best fit their beliefs, ideals, and needs of their family on an individual basis, as these rights should never be infringed upon. The enforcement of any such mandates of any kind will have a negative effect on the morale of staff, students, and visitors who come to Van Buren schools for events. Also, as Local 783, we would like to thank Mr. Brian Bloom for all the effort he has put into learning about this virus, keeping up to date on the details, meeting with the health department, and countless other items involved with COVID. He has been a true leader and kept everyone informed, moving forward in the same direction. Professionally and sincerely, Michael W. Trout, President. Why am I supposed to see this up here since that one's done?
Okay, at this point, I guess the last three of us that just came up and talked, if there's any questions, we could try to answer to the best of our ability.
I guess what was the average absence before COVID?
I wish I could answer that, but I've only been here during COVID. So I don't know what it was before that. I'm not sure how to even answer it. I don't know what the averages were before COVID. I wish I could tell you. I just don't know.
Would it be fair to say though, in your numbers, those aren't all COVID?
The ones right now, how it's coded, I took out all of the ones and applaud. I don't know. I didn't realize so many people took vacations during this time. So I take those off, and like tardies, early dismissals. If it's coded, like a lot of people are going to the dentist and things like that, I've taken it out. So the only ones that were counted in these numbers are actually ones that were coded, like parents called in and called their child off sick. It doesn't mean they had COVID. That's just the number of people that called off sick that day. Yes, sir. Well, like Mr. Kelly was saying, that we've been doing a lot of those, the cleaning. We tried early on. Last year, there was a lot more, if you remember, those hybrid days, and to keep the class sizes small and try to social distance and things like that. The social distancing, now that we're back 5 days a week, is a much more difficult thing to do, to try to do that. But we try to do those things. I know I've seen teachers take them to the restroom, make sure that they're washing their hands or using hand sanitizer before they eat, especially at our elementary school. Our elementary, without question, is having the highest number of absences. Again, I don't know if it's all COVID related or not, but that's our highest one. Mr. Kelly, am I missing anything else that we've been trying that you want to talk about?
Okay, one of the things I forgot to mention was we realized too, I know a comment was made tonight about the airborne. We wash our hands, we wash the desks, we wash the surfaces, but we realized too that it's airborne. So one of the things we did almost immediately was we removed all the filters from all of our air handlers, the VAV boxes, and anything that had a filter in it, we removed them. And we replaced them with it's called a MERV 8. It's a tighter particulate. So it helps to filter the air better, right? So we also went in at that same time and we cleaned and sanitized all the air handlers. We continue to do that on a regular basis. The recommendation for the system that we have is once a year to change the filters, or it says check the filters. We actually are changing them twice a year since COVID took over. We sanitize them before we put the new filters in, pull the old ones out, we throw them away. I also met with a company yesterday to talk again about an ionization process for all of our air handler systems, just to see if the price came down. It's really, really, really expensive. And we talked about it a couple years ago, so I just wanted to revisit it again to see if it's become an option for us. So I think that's an important thing that is helping the students too.
Any other questions? Nurse Judy, what question do you have?
I actually have a question for Kareem. Is there going to be a study, or is there one already, on the positivity numbers since we've gone from 14 days to 10 days and now 5 days? I have several parents that question me about that on the phone. They don't feel comfortable with the 5-day mask, and then they can come back to school when it used to be 14 and 10. Just since we've been back from Christmas break, so we're talking 3 weeks, I've had several days where almost my entire 8 hours is spent on COVID. Reading emails, responding to emails, listening to the voicemails that the secretaries send me, then calling those parents back, doing my logs, doing my reports to the staff, doing my reports to the health department. But what it comes down to is parents asking me, why did they lower it to 5? And I know it's to try to keep the kids in school. Is there a study on those numbers for real they're reading?
I think there is a study why they lowered it to 5 only, because they found out that the most infectious period is day 0 or 48 hours before actual symptoms to day 5. So they wanted to keep kids in school. And like I said earlier, science do evolve, we do change. Back in 1918 with the pandemic flu, probably a speed on the highway was less than 70. So we do evolve. I mean, that's why we have to keep an open mind. And there will be studies here moving forward. I can assure you that we've been talking with the state health department on changing the contact tracing at schools. I did mention that to the superintendents last Wednesday, and there's a huge progress because it's becoming a moot point with spending all your time on contact tracing, or getting answering the questions when it comes to contact tracing. We want to streamline it to make it easier for the schools to handle, to make it easier for the parents to not to confuse things too much, and streamline it. Moving forward, with that many cases we're dealing with, our phones are ringing as fast as yours. You're sure of that. But we want to streamline it to a point where, okay, like Brian said, if you're sick, please stay at home. If you have a kid that's not feeling well, keep them at home. We want to get to that point. We've talked a lot about mandates and stuff. We're all against mandates here. It's not about mandates. It's about protecting each other. We want to make it natural for our kids. If I'm not feeling well, I'm going to put a mask on for a couple of days. Let's project on them the good thing about the mask. And there's always bad things about the mask. I mean, the gentleman mentioned, that there's a lot of things growing on the mask and stuff. But nonetheless, let's project them the positive part of it. I mean, it's important. As educators here, as parents, as kids, we need to project the positive so we can help each other get out of this mess. But I do appreciate your work. You're great. You're a champion of public health. You're a champion for the kids and their parents here, and we do appreciate it. My staff back at the office appreciate your calls all the time because those are good questions you bring up. Thank you.
Okay. Any other questions?
So is the virus, is it airborne or does it travel on water droplets?
It's mainly airborne, especially with that Omicron. If it's on the surface, it won't survive for a long time, and that's why it's highly transmissible. But in the air, it's spread like crazy. Or less. Sure. And that's why we're saying now N95 are better for that Omicron. And again, as we're learning more, we're coming up with better guidance. And I don't think we should kind of take offense to that you told us cloth mask will work back 2 years ago, but we were in a different situation. It was a different kind of virus, like Dr. Ko said. We have to keep an open mind. N95s are the best, but I tell you, the surgical mask will work, less than the N95, but better than the cloth mask. So, and to me, any protection is better than nothing, to be honest with you. And it's not with or without. We should always seek the N95s. We have them at the health department. I think we offered the school to have some here for your use. But N95s are hard to handle all day, to be honest with you. And that's why I think we want to make it easier using a mask when we need to, and not for a long time. All we're saying here, please, for a couple of weeks until we get those numbers down a little bit so we can get a better handle, so our hospital system can keep up. That's all we're asking. I'm not, or Dr. Ko's advocating for mandates here, not at all. We're advocating for a self-discipline, self-responsibility feeling that we instill in our kids to say, okay, if I'm not feeling well, if I have the sniffles, if the transmission is so high in our community, let's wear a mask for a couple weeks. That's all. Yeah, well, that's a good point you bring up, and that's a good analogy. I don't know if it's totally same. A good test, we tell people if you to tell if your mask is effective, do the candle thing. Blow on a candle with a mask and see if any of that air is coming out, any of your breath. Again, we don't want to put a huge burden for people to use N95s and keep them, loose on the sides. It won't be effective either. It's how you wear your mask and where you wear it, to be honest with you.
Well, we left some time in our program for comments and from our community. So do you have any, or do you feel like you've had an opportunity to say everything you want to say? Any other questions, comments?
I just have one question.
Uh-huh.
Not related to masks, sorry. I'm just wondering, for close contact in the school, how do we determine, I know other people who get lots of emails, like, hey, there's been a case in the school. I'm not asking for email every time there's a case. But I haven't gotten any emails about anything, and I know, like, one of my daughter's teachers did have COVID. Now, I don't know how close she was to the teacher, but I'm just curious as to how we determine who gets contacted, because that maybe something we can look at as well, just so you have a heads up, like, hey, your child was exposed in the classroom. That way we pay more attention to that sneeze because you pepper, or because something maybe just so they can see more trouble. I mean, I know I've called my kids out of school for things I would have never called them out for previously, just because I am more vigilant. This year, the previous year. That's
Okay. Do we know?
When it comes, that's what I believe Nurse Judy, that's what you've been talking about most of her day. So if there's deemed a close contact, she will send something to you through. So that's what's been happening. So do you want to talk a little bit how you do all of that, Nurse Judy?
Within the school setting, I think we go by 3 feet. And then outside of the school setting at home, it's a 6-foot distance. I personally don't have anything to do with determining who contacts are. When I'm notified of a positive student, I send out an email to the appropriate principal, and I say, this is when symptoms started, this is when he or she tested. Please look for close contacts for me, and I give them the date stamp. And then I'm at their mercy as far as when they reply to me with their list, and sometimes it's a little list. And then I have another principal that gives me a list like this. And then I turn around and send out the letter from the health department to notify. Yeah, yeah, because I have no idea in the classroom who sits where, how close they are. I put that in the principal's hand.
I will add one more thing, and that's excellent. That's the right protocol. The school have the responsibility to notify other parents. Me as a parent having kids in that classroom, they owe me a notification saying, okay, your kid's been exposed. And that's how we're doing it, 3 feet, depending on the situation. I think all the talks been last year, even before the Omicron and the vaccines, we were talking about going as surgical as possible when we determine who's been exposed. This is important because we want to keep as many kids in school as possible. And that's why we depend on the teacher who's there, on the masking policy of the district, on a lot of variables to determine who's been exposed and who's not. But that's how they go about it.
Any other comments, questions? Yeah.
Mike, they were saying online they can't hear anybody. Sorry.
Thank you. We just had a new furnace put in our house last fall, and they were pushing the Rheem. I think it's Harlow or Halo. It's some kind of thing that goes on the cold air return duct. And I don't know if is it ultraviolet light, or somehow they claim it even kills COVID. I didn't know if that'd be something to look into. It was a little pricey, like $300 or $400, and we have like a 2,000 square house. So I don't know how the classrooms are duct, if there's some tied together, if it all be separate. But and then even is it Kareem from the health department? Have you heard anything about that? If it's effective or not, or if I just kind of overpaid for whatever you want to call it?
I mean, from my readings into this, and Dr. Kus probably they use some of that technology at the hospital maybe, but it's good for really enclosed small areas because when you want to kill a virus or you kill any agent for that matter, you want contact time. You know, how long is it going to take? UV is a lot faster than bleach we use on surfaces. But to clean a room like this, it's going to take a lot longer using UV to be able to clean it well. So cost effectiveness and practicality, I think UV will not work in large areas like a school.
Okay, thank you.
Yep, thank you.
Anyone else? Where? Oh, sorry about that. There you go.
It's not necessary. Well, I actually do have a question, but this first part's not a question. I do appreciate that you guys are asking. Honestly, I didn't know this was happening tonight. I've been trying to come to these anyway, and I was shocked to see so many people here. But I do appreciate that you're asking. I thank you that hopefully there won't be mandates. I do think it should be a choice because there is so much information. We should be allowed to look at the information, make our own choice of what we think is best to do for our families. I also don't know what the mandates are for your faculty and staff. I hope also that you don't have to mandate there because to me that still should be a choice. I do have one question that I really have no idea how to answer, and it's a curiosity question, probably for maybe Kareem or Dr. Kos. If you're concerned about your health and you want to wear the mask and you think it's keeping you safe and you want to wear that, that should be fine. But if I don't wear one, how does that make it worse for you? If you're wearing one, you're already protected. So I don't understand the whole thing. If you want to be protected, you wear the mask. If you feel that you don't need it or whatever, why would I have to wear one to protect you?
I think we said multiple times we're all in this together. And again, I'm wearing one to protect all of you. I'm wearing one to protect my family. I'm wearing one to protect my colleagues and our school board. The mask, I mean, we're mistaking the mask a lot. And I've heard some comments about we only have 15 kids. The mask is a prevention. So we don't know, we don't want to end up with a lot of kids being sick or being the virus transmissibility here in the school high to start wearing a mask. It will be too late. It will defeat the purpose. The mask, I think it should be a personal responsibility. I perfectly agree with all of you almost here. And my personal responsibility to the community, when I'm in a social setting, in a school setting like this, congregate, I have to respect the others and their health, and that's why I wear a mask. And again, it should be a choice. I'm not disagreeing with that, but I'm hoping that we will make the right choice based on the right information we get. That's all we're asking.
Anyone else have a question, comment? No? Okay.
Sir? Okay, well, let me again thank you all for coming out, and I apologize the meeting ran a little longer than I was thinking was going to run, so thanks for sticking in with us. I want to just end by thanking all the members of the Board of Education, Laura, Mike, Andy, the moderator, Kim, and also Dr. Kos and Kareem, and of course, Dawn, our fabulous treasurer, and Brian. We all love Brian. He's done a great job. So thank you all very much. I really appreciate it. We all appreciate you coming in, and I'm really proud of us for being able to have a conversation about stuff. So thank you very much, and have a safe evening and a great weekend. Thank you.